Focal nodular hyperplasia is a benign liver lesion which is usually solitary and much more common in women. It presents mostly as an incidental finding on imaging, although some patients experience vague abdominal pain. It's treated conservatively as prognosis is excellent. Now, in terms of its epidemiology, it usually presents between the ages of 35 to 50. It's the second most common liver lesion that's not malignant, following hepatic hemangioma, with a prevalence of between 0.3 to 3%. Now, most importantly, 90% of all cases occur in women. Let's move on and summarize its pathogenesis. FNH is thought to be an overgrowth of hyperplastic hepatocytes. Now, this term implies that they are regenerative and possibly as a response to an arteriovenous malformation. Macroscopically, the lesion is typically firm, solitary with well-defined margins, and composed of a central scar. In terms of size, they're usually smaller than 5 centimeters. Moving on to its clinical features, the presentation of FNH may be suspected in a patient without cirrhosis who is found to have a solid liver lesion on imaging, but is otherwise completely asymptomatic. In saying this, symptomatic presentations do actually occur in about 20% of cases due to right upper quadrant pain from a mass effect. Physical exam is usually normal, although larger lesions may be palpated. In terms of investigations, blood tests are usually normal, including LFTs and alpha-theta protein. Notably, accurate imaging can help with diagnosis to prevent unnecessary intervention. Key options include contrast-enhanced ultrasound, a multi-phase liver CT, and an MRI. Now, a biopsy of the lesion is not routinely indicated to confirm the diagnosis. However, it might be necessary if the contrast-enhanced imaging features are not typical of FNH. Moving on to the management of focal nodular hyperplasia. As the prognosis is excellent, with complications being very rare, minimal intervention is advised. Surveillance imaging is not routinely obtained as there is a low risk of lesion growth. In symptomatic lesions that induce persistent abdominal pain, they might actually require procedural intervention. One option is surgical resection, although this can be quite invasive. Consequently, approaches including transarterial embolization or radiofrequency ablation are often preferred. Now let's summarize this really common but benign lesion with a quick mnemonic. My acronym is FOCAL, which stands for female patients who have an oval lesion with a central scar, which is asymptomatic on their liver. If you like 3-minute videos with easy mnemonics to remember, then check out this playlist. Thanks for watching Townsend Teaching.